Good morning, everyone. Happy morning, everyone. Welcome to another episode of Health Hub. We have been seeing since 2 years how COVID impacted our lives physically, but the ill effect it has created in our mental well-being is often ignored. The COVID-19 pandemic has created a mental health crisis due to lockdown restrictions, overwhelming numbers of COVID-19 cases, financial difficulties, etc. This mental health crisis has led to a high degrees of fear, anxiety, and depression among every single person possible. Let us peep a bit about this in our health darbar today. But before we dive into the topic, I invite Sonali to do the morning prayer. Over to you, Sonali.
Good morning, everyone. Today, 31st January 2022, आज की प्रार्थना ओम भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ओम भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ओम भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. Thank you. Have a lovely day, everybody.
Thank you, Sonali, for that small and beautiful prayer. Now I invite our expert for today. She doesn't need any introduction. Bhakti Mehta ji holds an experience of more than 25 years in educating and resolving the psychological issues of thousands. And we are fortunate to have her on our platform and educating our health educators on very important topics. We have kept these episodes in a question and answers format. First, we will discuss the queries that are posted in the group, and later the platform is open for the discussion. And if the response is very good, we are unable to complete the questions, we can take it to the other session later. Over to Bhakti ji. A few lines about impact of COVID on psychological issues, and then we can move to the question answers. Shall we?
Yeah. Good morning, everyone. So, because we have less time, I'm going to jump into the topic directly. COVID has brought a whole plethora of psychological issues, especially in people who are teenaged and in middle-aged individuals. Mostly, it has caused due to change in lifestyle. It has caused marital problems. It has caused anxiety. It has caused a lot of phobias. It has caused depression. In teenagers specifically, there has been depression. Teenage anyway is a period where they're exploring the world around them, and for them to not be able to do that for 2 years almost has been a very difficult time for teenagers. Another thing that COVID unfortunately has done for us is people who are predisposed to mental health issues. COVID has become a trigger. So if there has been a predisposition to mental health issues in the family, people have developed mental health disorders because of COVID, which in the normal circumstances may not have been a trigger, but unfortunately COVID has kind of done that for them. So a lot of individuals who are healthy, mentally healthy, have after COVID had mental health problems. So definitely COVID has contributed to mental health disorders vastly. Unfortunately, because we're trying to save lives, mental health hasn't been given as much focus as it should have. But I think now slowly people are kind of realizing that it's important to even think of how it's affecting you mentally. Should we take questions now?
Yes, ma'am. We'll dive into the first question. Impact of lack of social life, especially in young population, due to the closure of schools and colleges. You comment about it.
Like I said before, teenage adolescents, young adults have been impacted because of this lack of social life. Also because a lot of their information, a lot of their social skills, a lot of their doesn't come from parents. Social skills normally come from associating with others and imitating others, and that has taken a hit because they haven't had the opportunity to socialize with people their own age.
How has the gender inequality impacted the mental health during COVID?
This is very important. ये घर में husband and wife, brother, sister, or even if it is girlfriend, boyfriend, जो भी आप बोलिए, in a relationship, any kind of relationship, because there is a parity, there is an inequality between the male roles and the female roles. हमारी society में or everywhere else also, because the man and the woman are in the house during COVID and all the time, this has become a major issue. Most of my cases in these 2 years, apart from COVID, has been relationship. Whether it's parent child, whether it's husband wife, whether it's sister brother sister, whether it's spouse or lover, whatever you call it, because of this inequality, it has impacted. I think people have become more aware. Also, to give the men a little bit of credit, I feel कि ये ऐसा generation है जिन्होंने अपने मदर को स्लाइटली डिसएडवांटेज पोजीशन में देखा है और अपनी वाइफ को जो पढ़ी लिखी है अभी, who's educated and she's aware, उसको different social status में देखा है, and for the men to understand that has become very different and very difficult. So especially in COVID, when the woman expected to get more help and more empathy from the spouse, and the spouse also, I mean from the husband also expected the same, कि वो मेरा ध्यान रखे और मेरे family का ख्याल भी रखे और ये भी करे वो भी करे, मुझे office में help भी करे. It's become very difficult, and this has been a very, very difficult time for basically gender inequality and the realization also. But Abhi, I think if it's done harm, it is also done good, because I think most people have realized that it cannot work like that. I think it's equality to kabhi ho hi nahi sakti hai, mujhe nahi lagta hai, because it's difficult to, but there has to be equal roles and shared roles, and that is important.
Interpersonal relationships.
We just spoke about this.
Yeah,
we just spoke about this.
Once the schools reopen, what should be the role of parents and school counselors to reduce the impact of school closure on mental health of the children? How to go about when schools are open?
एक तो it's very important कि बच्चों को स्कूल भेजें. In a fear कि भाई कोविड हो जाएगा, हमने बच्चों को अभी तक स्कूल नहीं भेजा है. I think the establishment, the institution should realize that it's very, very important for children to go back to school, and there are different ways to do that. पूरे class को नहीं बुलाए, sections को बुलाए, they can do it in different ways. Of course, it won't be like a full school, but they will get the opportunity to be with people their own age. School counselors have a very important role. They have to do a lot of psychoeducation. There will be children who will be coming to school with high anxiety about getting COVID, which is obviously passed on by the parents, or the anxiety may be because of a situation at home with COVID, whether they've lost somebody in the family, whether they've had a really bad COVID situation in the family. So here the school counselors have a big role to do psychoeducation, which means classes repeatedly बच्चों के साथ talks करें, उनके साथ open door policy. Normally what happens in schools is that the counselor calls the child if she feels the need, but it's important to, at this time at least, to have an open door policy, which means the child enters without an appointment, without being called, just because she or he is uncomfortable. So that's very important. Parents, it's very scary to send the children back to school, but it's doing more harm to them by being in the house. And I understand there are some children ऐसा लगता है कि उनको कोई फर्क नहीं पड़ता है, they are happy being at home. But you learn the rules, you learn the discipline, and you learn how to socialize. उसमें कितना important है ये socializing with your own age group. You learn to network, you need to learn to form bonds. ये जो bonding है वो 2 साल से छूट गई है, और जो बच्चे वापस स्कूल जा भी रहे हैं, they are finding it very difficult to bond with the same classmates that they were bonding with 2 years back. So it's important for us to give them that chance and send them back to school. I think the parents' role is to take it easy, send them back to school and watch for signs. And अगर आप constantly WhatsApp पढ़ते हैं, constantly ये discuss करते हैं, COVID में ये हो गया, उसको ये हो गया, that kind of builds anxiety in children. We don't want that to happen to children. So if there is information, first of all, WhatsApp doesn't have true information all the time. So ये तो एक, you have to kind of see through that information and don't make it your only conversation in the house.
Yeah. Next question is, people are feeling awkward to socialize in person after a gap of almost 2 years. Is this normal? And how should they motivate themselves to go back to the some normalcy?
In my experience, people are dying to socialize with other people. I think the only जिधर तकलीफ हो रही है इसके भाई उनको लगता है मुझे कोविड हो जाएगा and मुझे कोविड हो जाएगा. So this brings about a lot of fear and anxiety, and unfortunately our media doesn't help. Our media is always talking about this. If you put on the news channel ever, मैंने तो बंद ही कर दिया है, मगर if you put on any news channel, they're only trying to scare you. So this fear is coming from multiple sources. कि भाई, it's difficult. और एक बात है कि 2 साल पहले जिनके साथ आप you knew everything about them. उनके घर में क्या बना है, कौन आया था, कितने दिन रह के गया है, you knew everything. ये 2 साल में अपना ये relationship जो था बिल्कुल छूट गया है, because कितना आप WhatsApp करेंगे, कितना आप मैसेजेस करेंगे एक दूसरे को, और कितना Zoom कॉल्स भी कर लेंगे एक दूसरे को. So ये छूट गया है. मगर baby steps is very important. जो आप पहले 2 साल पहले करते थे, it's important to restart that. I'll give you an example. हमारे बिल्डिंग में जो elderly होते हैं, तो उनको हम at least once in a week we used to go meet them. We used to एक दूसरे के घर खाना भेजते थे. ये सब जो था कोविड में बिल्कुल बंद हो गया था. 3-4 reasons. एक, उसी के घर में स्टाफ नहीं. Though everybody was busy in there because your husband was at home, children were at home, wife was at home, in-laws were at home, everybody was busy with their families. So ये जो हम अपनी ही लाइफ में बिल्कुल busy हो गए थे, that needs to kind of go back to what it was, meet people outdoors, it's not a problem. Open air mein mile, mask pehen ke mile, at least you're getting some kind of human contact. Also, जो आप पहले एक्टिविटी करते थे नेबर्स के साथ, नीचे जाके चलना, थोड़ी देर साथ में बैठना, you can start doing all of that. See that it's very, very well ventilated, it's open air, you are wearing a mask, and you will be fine.
So our next question is about screen time. What can be the implications of increased screen time due to this pandemic?
One obvious implication is on your health and eyesight and your hearing. ये जो in the picture इसने जो headphones पहने हैं, these are the worst things for your ears. Children are already because वो virtual पढ़ते थे, or they would have these on for 10 hours mostly, headphones. तो already बच्चे complain करते हैं earache का, और infection हो जाता है उनको, and because they would have their volumes on so close, so obviously there's an impact on your eyes. So these are obvious implications on your health. Apart from that, any kind of gadget gives you a very impersonal way of dealing with your relationships, right? आपको face to face नहीं, you can't have a conversation face to face, you cannot make eye contact with anybody. ये जो digital relationships है, they are very, very difficult, and they are addictive, especially for children. If you're reading a book, आपका book at least 5 minutes एक पेज पे concentrated होता है आपका eyesight. In anything that is moving, every second there is a different flash on the screen that makes you आपका जो focus होता है, अगर आप 10 minutes focus कर सकते हैं on a book or any task, ये जो gadget होता है, कोई भी gadget हो, when you're looking at, you're playing games, when you're looking at TV, watching TV, you're playing games on your iPad or whatever it is, the screenshots are moving so fast that it's very difficult then to concentrate on something that's not moving. So there is an implication on concentration. There is an implication on relationships. It's very difficult to from screen because it's so impersonal. आप कुछ भी बोल सकते हो. And the rules of politeness, the rules of being courteous, or the rules of being kind, all this unfortunately in इतना impersonal way of communicating है कि ये सब हम भूल जाते हैं, हम कुछ भी बोल देते हैं किसी को क्योंकि उसकी आंखों में नहीं देखना है हमको. So these are very, very on the top implications of gadgets and screen time. Of course, we can go into it more in more detail, but very, very serious implications of increased screen time on everyone. मैं बच्चों की बात नहीं कर रही हूँ. Average, on an average, an adult is on screens for more than 7 hours a day.
Yeah. So any tips about bettering the current situation with respect to mental health? Yeah.
Mental health. So one, socialization is very important. You can make it as personal, as impersonal as you are comfortable with. अगर आपको लगता है मेरे घर में मेरे माता पिता है वो vulnerable, तो घर मत बुलाइए. But you can see that you go out and socialize with people. Be very careful. COVID appropriate behaviors are very important, but it's not impossible to save yourself from getting COVID. अच्छा, अगर हो भी गया COVID, आजकल सबके घरों में हो गया है. एटलीस्ट हमारे मुंबई में तो every house has COVID. और अगर हो भी गया तो luckily for us in this wave इतना serious COVID नहीं हो रहा है. People are recovering in 7-8 days, or the ones who are not recovering and have to go to the hospital, very few, also getting hospital beds and they're coming back in 2-3 days. So हो भी गया COVID, so it's not such a big issue. ये आप at least in this wave, it's not a big problem. ये आप you be very sure about that. Even still, आपको अगर लगता हो कि नहीं मेरे घर में किसी को कैंसर है, किसी बहुत बीमार रहते हैं और उनको नहीं लगना चाहिए, don't call people home, but go out and socialize. Because as a caregiver, if there is a very unwell person in the house, as a caregiver, it's important that you be mentally strong and mentally stable and mentally healthy. And for that, you need people. Okay, I'll give you an example. जब भी हम ऑफिस जाते थे, I'll give you my example. जब भी मैं ऑफिस जाती थी, मैं 5-6 लोगों को देखती थी, बात करती थी, मेरे कॉलीग्स, मेरा स्टाफ. It had a different effect on me. आजकल जब भी मैं virtual therapy करती हूँ, it has a completely different effect on me. I can't do. मैं normally when I go to office, I would sometimes even see 11-12 patients a day, and these are full-fledged, not full-fledged sessions, which are 30 minutes, 35, 45 minute sessions. I could do 11 sessions a day. Long days, but I could do it. अभी मैं 4 sessions से ज़्यादा नहीं कर पाती हूँ, because one, I have to, the human contact is missing. Then I don't have a stress buster. I don't get a break. It's difficult for me, and it is the same for everybody who is working virtually. So it's important to make the best out of this situation. Please go out and meet people, but be careful.
Yes, ma'am. Thank you. 1 second. Hang. Yeah. People with severe mental illness are more vulnerable to adverse impact of COVID. As a policy, shouldn't they have been given priority in vaccination? It's a policy linked thing, but
no. So let me just answer it very quickly. See, the thing here is that they are definitely more vulnerable to the mental health effect of COVID. Definitely. Not only them, their primary caretaker and the family is also impacted because of this. But because you are trying to save lives, it was important to give vaccines first to people who were saving lives and also the people who were vulnerable. And that's why vaccines were given to them first. Even today, mental health, unfortunately, is not given that much importance, but I think it's getting better.
So next comes the question, stress leads to anxiety and anxiety leads to depression. How to manage it effectively during COVID?
Stress leads to anxiety, yes. Anxiety doesn't have to lead to depression, okay? Anxiety can be very well managed. Stress also can be very well managed. There are different types of stressors. It depends on the kind of stress you're dealing with, right? It leads to anxiety. Anxiety leads to panic, okay? बहुत easily हम अपना ये anxiety या stress manage कर सकते हैं. One of the things that we can do very easily at home without anybody's help, okay, is to do yoga. And when I say yoga, I'm not saying that you should do breathing only. क्योंकि अगर जैसे योगा बोलते हैं, people sit in meditation and start doing breathing exercises. No. Yoga can help in, of course, the breathing helps. Breathing is a very, very important important way of dealing with your stress, the right way of breathing. But yoga, the different asanas help tremendously in lowering your stress level and in anxiety. That is number one. Number two, yoga is not exercise. Rigorous exercise is very, very important, which means agar aap young hai, अगर आप दौड़ सकते हैं तो दौड़े, जिम तो अभी जा नहीं सकते हैं, मगर if there is some exercise that you can do at home, do that. If you can't run, if you can go for a walk for 45 minutes every day, do that. This is a stress buster. Another stress buster is chatting with your friends or chatting with the family. Find ways to learn new skills. These are all stress busters. It doesn't necessarily have to lead to depression. We can be managed very, very well and can be managed. This can be a whole completely different session of how to manage stress and anxiety. But I'm just telling you that ghar pe baithe, without any help, you can manage your anxiety and stress.
Agreed. It's a big topic altogether. Next, we move to another next question. How to cope up with the fear of being sick post-COVID recovery, especially in elderly people?
This is very important. ये मेरे जो elderly, because I do elderly care, मेरे जो elderly patients हैं उनमें बहुत ज़्यादा है कि एक बार वो recover हो गए हैं उसके बाद उनकी heart beats, जैसे कोविड के बारे में सोचते हैं तो heart beat बढ़ जाती है, they start feeling anxious and things like that. But that is on one hand true. अभी थोड़ा strange लगेगा if I tell you what I do with my elderly patients. I tell them to do whatever it is that they haven't done in their life, which means that one of the fear of being sick is of course death, and death is a reality. उसका कुछ हम नहीं कर सकते हैं. मगर before you die, it's important to you that you do whatever it is that you wanted to do. One of my elderly patients has started taking, 68 years old, just started taking Kathak lessons. So the thing is that ऐसा नहीं है कि she wants to perform in front of anybody, but it just gives her hope and it gives her something to do every day, especially for people who are retired and don't work. It's being at home and thinking about COVID all the time, hearing about COVID all the time, reading about COVID all the time. And not just the elderly, it affects everyone. So if you are learning something different, we're doing something different. There is a lady, elderly lady, 73-year-old, who has started, she had stopped cooking completely because, gharon mein staff hota hai. And she has started cooking recently, and she's making all the recipes that she was eating when she was a child. And that's how she keeps herself busy. So it's not difficult to do this, but the more you think about COVID, the more scarier you're going to get. So diverting attention and doing something that you enjoy doing is important.
Yeah, the rule applies to everyone actually. We should be learning continuously until we realize. थोड़ा एज बढ़ने के बाद हम realize करते हैं. So let's go to the next question. How to differentiate between normal anxiety or over anxiety, which could lead to the behavioral disorder?
So anxiety is a clinical word. Okay. And anxiety ka very normal word, जो regular word है, जो घबराहट. Fear and anxiety are two different things. Okay. Anxiety is something that you need help. It's a clinical word. You need help with it. Normal anxiety mein, there are two types of stressors. There's eustress and distress. Eustress is a good kind of stress. Exam ke pehle jo thoda sa stress hota hai, ek baar exam likh lo, then you're free. Okay, this is a good stress. Distress is jab bhi aapko you keep thinking about it, your heartbeat increases, you keep thinking about it all the time, it interferes with your daily living and your routine. That is not normal. Okay, that is anxiety. So if agar aaj main full जो घर का कुछ जो भी काम होता है कि मेरे बिजनेस का काम होता है कि मेरे ऑफिस का काम होता है, fear के साथ, stress के साथ भी अगर मैं if I can do it, then that's fine. वो सबको होती है. There's nobody who is without stress and anxiety, right? But if you cannot, and if you feel that I'm so anxious that I have to sit in one place, I think about it all the time, मुझे भूख नहीं लगती, नींद नहीं आती, continuously घबराहट होती है, I'm losing weight, then that is not right. There you have to take help.
This is a little off topic, but one of our educator wants to know about agoraphobia. Is it curable? How to deal it?
Yeah, it's completely curable. It's a fear of going into crowded places and being in the open, completely vulnerable. There is a clinical method which is called behavior management, where we help to deal with this very easily curable. In fact, there have been multiple people on this platform who've asked for help for this, and we've been able to help them. And it's not a problem. It's maybe some people have it in a more serious condition, and some people don't. But completely, it's very curable. And I can't tell you how to deal with it right now because we don't have the time. But if there is a genuine, if you're suffering, you can get in touch with me on this platform, and we can work with it. It's not difficult to deal with.
Yes, ma'am. Thank you for being here and filling up the place and addressing all the issues frequently asked questions about. Rakesh ji, कुछ पूछना चाह रहे हैं?
डॉक्टर मेहता, भक्ति मेहता जी, नमस्कार।
नमस्कार।
मेरा था कि जो महारोग हैं, जिसे मानस रोग कहते हैं, जो एक्चुअली नॉन एग्जिस्टेंट हैं, जो रोग वास्तव में नहीं हैं, और जिसे मैं अपनी भाषा में कहूँ तो बहम रोग कहते हैं, उनसे अपनों को कैसे छुटकारा दिलवाया जाए?
मुझे थोड़ा इलैबोरेट करेंगे, ये महारोग क्या है?
हाँ, जैसे भाव रोग है ना, जो है ही नहीं, बहम है, बहम रोग जिसको कहते हैं, बहम पड़ गया कि कोई चीज है नहीं, उसको मन में बसा लिया और उसी के बारे में लगा रहना और उसी के बारे में डर बना के उसी के पीछे डरते रहना। जो हमारे बड़े हैं, उनको बहम रोग से कैसे बचाया जाए?
सर, ये जो द फियर ऑफ द अननोन, या ये जो फियर है कि कुछ हो जाएगा, वो एक्चुअली इट्स अ न्यूरोटिक डिसऑर्डर। उसको क्लिनिकली आप क्लिनिकली डील करना पड़ता है। और ये जो आप बहन रोग कह रहे हैं, इसके लिए मेडिकेशन चाहिए। वेरी ऑफन, डिपेंडिंग ऑफ कोर्स आपका कितना इंटेंसिटी है, क्या है। कभी कभी जस्ट थेरेपी से ठीक हो जाता है, मगर कभी कभी इट रीचेस अ लेवल whether it becomes schizophrenia, and that needs to be dealt with medically.
There is one more question in chat box, Bhakti ji. Atul Mule ji पूछ रहे, old and handicapped, operated or ill patients cannot make exercises. So how to manage stress and anxiety without exercise?
How to manage? Okay. If it is stress, it can be managed by breathing. It can be managed by learning a new skill. It can be managed by keeping yourself occupied. It can be managed by जो belly breathing होता है, वो उसके लिए बहुत ही अच्छा, stress के लिए belly breathing is very very important and very very effective. A very good thing जो stress manage कर सकते हैं is writing. अगर आप अपने स्ट्रेसर्स हैं, जो भी आपको स्ट्रेस देता है या एंशियस बनाता है, एंजाइटी देता है, वो लिख लें। ओके, और उसके सामने एक ऐसा किताब अगर है और एक साइड पे आप अपने स्ट्रेसर्स लिख ले और उसके सामने आप लिख ले कि उसका मैं क्या कर सकती हूँ। इट्स वेरी इजी टू फाइंड सॉल्यूशंस फॉर योरसेल्फ। मगर दिमाग अपना ऐसा है कि एक चीज अगर सोचता है वो सोचता ही रहता है, वो सोचता ही रहता है। मगर as soon as you put it on paper, as soon as आप लिख लें उसको, then it's very easy to find solutions. So there are various ways for, I mean, if the person who cannot exercise, there are various ways of, music is very important. अगर elderly है तो उनके टाइम का म्यूजिक, if the person is now 70 years old, तो 70s का म्यूजिक, 80s का म्यूजिक, 90s का म्यूजिक, जो भी उनको अच्छा लगता है, that is a big de-stressor.
Yeah.
So it's not difficult to manage anxiety and stress, even if you are on the wheelchair, even if you are bedridden, even if you are very unwell. It's it of course needs effort, and it needs help from the family. Unfortunately, nurse आया नहीं कर पाती हैं ये सब, family को करना है. So but not difficult. And if there is somebody who wants concrete things to implement, you can get back to me on this platform and we can talk about it.
Yeah, there are many questions raised, hands raised, questions requested. We are running out of time. Rakesh ji, quick question.
भक्ति मेहता जी, कि एक सर्टन उम्र में डिप्रेशन हो जाता है, जो बड़ी उम्र की बात करें हम 70-75 साल की उम्र में जनरली हमने देखा डिप्रेशन हो जाता है। तो अर्ली लाइफ में कैसा जीवन हमें जीना चाहिए कि उस सिचुएशन से हम बच सकें? अर्ली लाइफ, आई एम टू से 50-60 साल की उम्र में हमें क्या करना चाहिए कि अवॉइड दैट सिचुएशन?
सर 50 साल की उम्र में स्टार्ट करना चाहिए, इवन बिफोर यू हैव टू स्टार्ट प्लानिंग योर रिटायरमेंट। आपको पता है कि मैं 70 साल तक अगर काम करूंगा, उसके बाद आई विल रिटायर, तो यू हैव टू प्लान दैट रिटायरमेंट। क्योंकि हमारे यहाँ कैसा होता है कि हम रिटायर होके घर पे बैठ जाते हैं, फिर घर पे कुछ करने को होता नहीं है, और बच्चे ग्रैंड चिल्ड्रन बड़े हो जाते, दे हैव देयर ओन लाइव्स, और अकेले पड़ जाते हैं, एंड दैट इज द रीजन व्हाई देयर इज डिप्रेशन। कि कभी कभी मेरे जो पेशेंट्स हैं वो बोलते हैं कि दिन में 1 घंटा भी कोई बात करने के लिए नहीं आता है। नॉट दैट द फैमिली इज बैड और नॉट दैट द फैमिली इज निग्लेक्टफुल, बट उनके पास उनका खुद का ही इतना लाइफ होता है कि उनके पास टाइम नहीं होता है। तो खाना भी टाइम पे खा लिया, साथ में खा लिया, तो बहुत बड़ी बात हो जाती है, बट एल्डरली शुड ईट। अगर आप 70 इयर्स के हो, यू शुड ईट अर्ली, 7:30 बजे तक खाना खा लेना चाहिए, क्योंकि डाइजेशन स्लो हो जाता है, तो इट गिव्स यू मोर टाइम फॉर डाइजेशन। और जो दूसरे होते हैं फैमिली, उनको 8, 8:30, 9 बजे खाना खाना होता है, तो वो भी दे कैन नॉट ईट टुगेदर। सो प्लान the retirement, planning a retirement is very important. Also very important, very, very important is to find occupation after your retirement. तो मैं मेरे रिटायरमेंट के बाद क्या करूंगा? पैसे कमाने के लिए नहीं, या आपको कुछ सोशल वर्क करना हो, या आपको कुछ बाहर जाना हो, या आपको ट्रैवल करना हो, all this planning is very important. मगर रिटायर हो जाएंगे, उसके बाद प्लानिंग करूंगा, then becomes a little, you can still do it, but it becomes a little late.
Yeah. रीटा मैनी जी,
सभी को मेरा नमस्कार। डॉक्टर, मैं ये पूछना चाहती हूँ कि जब हमारे सामने कोई मुश्किल स्थिति आती है तो हम बहुत नेगेटिव होके और बहुत एक्सट्रीम सोच लेते हैं कि ऐसा हो जाएगा, ऐसा हो जाएगा, जबकि वो बाद में हमें पता चलता है कि वो हुआ नहीं, लेकिन हम उसके लिए रोते रहते हैं और हम परेशान होते रहते हैं पूरे टाइम कि ऐसा शायद ऐसा हो जाएगा। उससे कैसे निकलना चाहिए?
See, everybody has to have somebody to talk to. ठीक है, बेटी के पास शायद माँ हो, माँ के पास शायद बेटी हो, हस्बैंड वाइफ तो बात ही नहीं करना चाहिए, आई फील, बिकॉज ये दोनों अपने ही टुगेदर जो ये खिचड़ी पकाते हैं, ये हो जाएगा वो जाएगा, वो दोनों साथ में पकाते हैं। तो मगर एवरीबडी हैज टू हैव समबडी टू टॉक टू, आपका फ्रेंड हो जाए या कोई भी हो। अगर नहीं है, okay, then one, either talk to somebody from the outside gives you a great perspective to your problem. और अगर आपके पास कोई नहीं हो तो meet a therapist. She is a completely डिटैच्ड एंड कंप्लीटली ऑब्जेक्टिव पर्सन, तो जो आपको रीजन करा सकती है, क्योंकि लाइक आई टोल्ड यू बिफोर, once our mind starts stressing and worrying about something, it has a tendency to keep on doing the same thing unless very focused and very effectively you are able to think otherwise. Another very good tactic is लिख लें और उसके solutions सामने लिख लें book में, और then you will see अगर मैं सोच रही हूँ वो बहुत गलत सोच रही हूँ, my line of thinking is only wrong, right? So but if you have a confidant, if you have a friend, if you have somebody who will help you, just listen to you, because when you're talking to somebody also, no, sometimes you understand मैं कितना बेवकूफी की बात कर रही हूँ, you know, that I'm being really silly. So that is important, कि आपके पास कोई हो जिसके साथ आप बात कर सकते हो, somebody who doesn't have an ulterior motive, somebody who's there to help you.
Yeah, it's always very interesting topic, and a lot of questions do come. So एक दो लाइन में शशि जी ऑलरेडी आ गई गीता पढ़ाने के लिए. So this is one way of going to the parasympathetic state of our mind, and so can we go 2-3 questions quickly, Bhakti ji?
There was one question, Vamsi ji, on neuroplasticity, which somebody had raised.
Yeah.
Is that person here? Sorry, I don't know the name of the person, but
निदेश जी पूछे हैं.
अच्छा है इधर निदेश
जी रहेंगे. He would have been listening to us. Yeah.
Okay, so just to let him know, neuroplasticity is possible. What is neuroplasticity? कि आपके brain में neural pathways और neural connections होते हैं, वो because of fear, stress, कभी-कभी and disease, कभी-कभी ये neural pathways जो होते हैं वो disconnect हो जाते हैं या टूट जाते हैं या उसको fusing कहते हैं, fuse हो जाते हैं. और बहुत elderly में, this is a especially COVID and elderly, उसमें बहुत ये problem हो जाता है. So it is just to let him know that it is possible, and there has to be a cognitive cortical remapping and neuro rehabilitation बोलते हैं. इससे ये difficult नहीं है, हो सकता है, but the only thing is कि जो टूट गए हैं, तो we have to make new neural pathways. One of the easiest thing to do that is to learn a new ability. कुछ भी नया सीखे. As soon as you do that, जिन्होंने कभी पानी भी नहीं उबाला है, वो खाना बनाना सीखे. Okay, and if you do something like that, it is definitely a possible.
Yeah. So it was a very interesting and very interactive session, Bhakti ji. As I said, it is very, very relevant and a very interesting topic to everyone over this platform. And we'll do another session. I'm very sorry that I couldn't complete all the questions in the chat box. So Bhakti ji is always here. You can join her in our OPD. And if the questions are to be discussed in the public platform, we have in this month, we have many more sessions with Bhakti ji, I believe. So thank you. So takeaway from today is pursue your passions, learn new things, plan your retirement, drink a good amount of water, do hydration, have healthy food, and speak to people, socialize with people. Yeah, leave the gadgets a bit, at least to whatever time possible. So have a good day. Thank you. Thank you very much.